Bueno, pues vamos a seguir con nuestro programa. Vamos con nuestra quinta ponencia del día de hoy, que está titulada Programas de apoyo para personas y familias que viven con TEAF, a cargo de Miss Jennifer Wisdahl. Jennifer lidera la estrategia y las operaciones de FASD United con un enfoque basado en datos y centrado en las personas. Jen ha impulsado un crecimiento significativo en FASD United mediante el apoyo a la red de afiliados, la difusión de la ley de respeto del TEAF, la creación del programa de navegadores familiares, la coordinación de la Semana Nacional del Impacto del TEAF y el regreso de las conferencias internacionales de investigación del TEAF, que se han trasladado de Canadá a Estados Unidos. Antes de trabajar en FASD United, Jen dedicó más de 20 años a apoyar empresas en recursos humanos, selección de personal y operaciones, y formó parte de diversas juntas directivas y paneles asesores a nivel internacional. Jen fue productora ejecutiva del galardonado cortometraje The FASD Project y es la orgullosa madre de 3 jóvenes adultos con TEAF y otras exposiciones prenatales a sustancias. Bienvenida, Jennifer.
Hello. Hola. If you haven't been wished a happy FASD Awareness Day today, I want to celebrate the fact that today is International FASD Awareness Day, and you are all here celebrating with me. So thank you for that. I'd also like to give a huge thank you to Jessica, Esteban, Aranza, and the rest of the team at FISAC. They have done a remarkable job with this conference, and I am so grateful to be here. I am someone who wears 2 very different but deeply connected hats. I am the Chief Operating Officer of FASD United, which for the last 35 years has been the national organization on support and prevention of FASD in the United States. And I'm the proud mom to 3 extraordinary young adults with FASD. So I come to this conversation with data on my laptop and snacks in my purse. Over the years, I've sat in many, many conference rooms talking about budgets, policy, program design, prevention, but I've also sat in school meetings, emergency rooms, court hearings, therapist appointments, intervention appointments, advocating for my children, navigating a world that too often doesn't understand fetal alcohol spectrum disorders. My perspective is shaped by both my professional role and my parenting journey. And I've got a few gray hairs to prove it. I was asked by the team at FISAC to address the following objectives: to learn about international models of psychosocial, educational, and community-based support programs for people with FASD and their families, to identify key components of effective family support and empowerment programs, and then reflect on opportunities for adapting and implementing these programs within the Mexican context. There's my kids. They're awesome. Oop, back. I'm trigger happy. All right, now that you got a preview of all my slides. Okay, so today we're focusing on support programs for people and families living with FASD and how we can learn from international models to build what families and people with FASD truly need: understanding, resilience, and a path forward. FASD is a global condition. It happens everywhere in the world. It's non-visible disability. So for example, in the United States, only 10% of people on the FASD spectrum have the sentient facial features associated with FASD. It's largely non-visible. And it's rooted in prenatal alcohol exposure, but support often depends on what country you live in, what city you live in, what your socioeconomic status is. Supports are not widely available. So around the world, we see striking differences in how families are supported or not supported. And that also explains a lot of the outcomes we see with people with FASD. Support is a key word here. People with FASD don't need to be fixed. They don't need to be cured, but they do need to be supported and accommodated. And families play the most major role in that. So I do have perspective personally with programs in Canada and the US, and then professional experience with numerous programs around the globe. And so these are a few that stood out to me. First off, I want to recognize the Families Moving Forward program that Dr. Olson mentioned in her talk earlier. This is a phenomenal program. It meets families where they are, gives them education about what FASD is and what they can expect from their child, and then works with them to create individualized supports that guide them through problem areas or behavior issues or things they may be struggling with as a family. But the thing I like about it most is it connects people to community. It makes them feel like they're not alone. The other one I really, really appreciate is PCAP, and Dr. Hemingway mentioned that earlier today too. That's out of the University of Washington. And that's a program that supports pregnant women who have already given birth to a child with an FASD or prenatal substance exposure. The cool thing about this program, though, is that it is shown to be 20 times more effective, 20 times more effective than prevention messaging alone. It's a great program. I strongly encourage you to check it out. Looking at Canada, many of the provinces have a key worker program. A key worker is someone educated in FASD who will come into your home and problem solve with you as a parent, supporting you in the home. I remember washing dishes with my key worker in Canada, crying because my kid was having problems in school and I needed help. And we were brainstorming together there at the kitchen sink, figuring out ways we could better support my kid. The other thing I really like in Canada, although my kids have not been justice system involved, I really appreciate the program in the Manitoba courts, which you'll hear about a little bit more later. I didn't realize that she was going to be here today, where they've integrated FASD into the justice system. Families and people with FASD often feel alone, and they have a hard time finding childcare. Our kids, there's a lot of correlation between FASD and ADHD. And I'll give you an example. My middle kiddo, when she got diagnosed, we were sitting in the diagnostician's office and she says, well, I don't know. I don't see a lot of ADHD in her. And we started talking. We weren't really paying attention. And she was supposed to be playing with a toy over in the corner. And then all of a sudden we realized she was literally climbing the wall because she was peeling pieces off the wallpaper, trying to climb it because she needed her sensory needs met. Finding childcare for our kids can be incredibly hard. So I really appreciate what No FASD Australia has done. They have a national helpline where professionals can get help and information and support. And they also have a lot of online support groups. Online support groups are a big thing because it helps cross vast areas. Mexico is a huge country. Australia is a huge country. There's some correlation there. I also really appreciated, I heard about this one, the Strongborn Health Promotion Campaign that was led by the National Aboriginal Community Controlled Health Organization. Say that 10 times fast. But that really showcased the power of culturally sensitive care in prevention. So they worked with the Aboriginal population to create a prevention conversation that met them where they were at. In the UK, National FASD has a really great program called Me and My FASD. And it's a way for youth with FASD to understand who they are and start the steps towards self-advocacy. It's a comic book they fill out online, and they can share that with whoever they choose to share it with, but it talks about their strengths. It talks about areas where they might need support, and it gives them some context to put their story in so they're not feeling like they're just a bad kid. In Scotland, FASD Hub Scotland, I was interested by their tiered support model. So they start out with a very minimal support layer because sometimes when you have a kid with an FASD and maybe the behaviors are really big right then because they're not accommodated properly, you don't have a lot of bandwidth to take in new information. So they have a tier 1 support, a tier 2 support, and a tier 3 support that becomes more therapeutic. I really liked those approaches. Now I'm using this appropriately. So these models all share something in common. They don't wait for people to fail before they offer support. And they don't rely on just one system of support. They start by asking, what does this individual, what does this family need to succeed? And what do they need to thrive? So at FASD United and as a parent, we've observed some successful support programs for families wherever they are share these essential ingredients. One, they're centered on the family. Sorry. I will just throw these away for right now because they're not doing me any good. They focus on the family. They're centered on how the family works. They're talking to the family as they're created. They're building on the family's strengths. They're building on what the family needs. Number 2, it's a lifespan approach. People don't grow out of FASD. We've spent a lot of time talking over the last couple of days about babies, about children. Well, children grow up and become snarly, snarky, I don't know if that translates well, teenagers. They grow up and become adults. They grow up and they have adult needs. They grow up and become older adults, geriatric adults. These are people with disability that need to be supported throughout their lifespan. So we need to be looking at support throughout the lifespan. A neurobehavioral framework. We need to stop punishing symptoms. So effective programs are grounded in the understanding that FASD is a neurodevelopmental disability, one that requires accommodations, not just consequences. And a word on consequences. One of the hallmarks of an FASD diagnosis is that cause and effect thinking in many people can be impaired. So punishment, consequences for people with FASD often is really not effective. So we have to rethink that and look at it through a neurobehavioral lens. How do we support the problems before they happen? How do we give them techniques to change that so it doesn't happen in the future? But punishment, and that's a hard one to learn as a parent, as a caregiver, as a teacher, as somebody who works with children, because our society is built around, here are your consequences. If you don't do this, then this happens. Well, when that is impaired, you have to look at things very differently. Peer support. This is huge. The number of times I have seen mothers, birth mothers, adoptive mothers, foster mothers, break into tears the first time they have met another mother who's raising kids like theirs is incredible. Families feel very alone. They feel very judged in their parenting. They feel very judged by the behaviors of their children. People with FASD feel very alone. They feel judged by their behavior. So having peers to talk to, other people who get it, is incredibly, incredibly important. Having an accessible, culturally responsive delivery. Programs need to reflect the language, values, and strengths of the communities they serve. So this isn't just about translation. This is about meeting people where they feel confident, where they feel safe, where they feel ready to receive support. You know, a brain in crisis, a brain in fear can't learn. So you can't get support. You can't learn if your brain is saying, no, 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 I'm in danger, or no, I'm uncomfortable. We need to create spaces where they feel comfortable. And then the big thing is, the last thing is cross-system collaboration. Success doesn't live in silos. We need to coordinate between health, education, social services, child welfare, housing, justice systems, all of them, so that they're working together and they're working in coordination. When we build on these values, with these values at the core, we'll see change, not overnight, but sustainable change over time. So at FASD United, our programs are guided by the belief that people with FASD are resilient, but they shouldn't have to be resilient every day. Through our Family Navigator program, we've helped thousands of families. We say nationwide, but actually it's worldwide. We get calls from all over the world. Find accurate information, trauma-informed support, and a path through the maze. We take calls from professionals and help connect them to other professionals. We don't fix families, we don't fix people, we walk beside them. And this line, this Family Navigator line, is staffed exclusively by parents, caregivers of people with FASD, and people with FASD themselves. So they're meeting peer to peer. They can speak with professionals. They have the information to give to professionals. If a pediatrician calls and wants to know how to get training on diagnostics, they can support them with that. They can direct them to that. But the most important thing is having someone there who gets it, someone there who understands, having that peer support. So the other thing we do with this Family Navigator program is we track every call we get. We track what they're asking for. We track the age of the person they're asking for. Is it for a youth? Is it for an adult? We also track what we can give them for support and what we can't give them for support. So we're drawing a national picture through data of where the gaps are in support and where the needs are in support for families across the US. Through our affiliate program, we support local organizations, state organizations, local leaders in building community-specific programming. So these could be support groups, mentor programs, diagnostic clinics, advocacy training, peer support. This program allows us also to disseminate awareness campaigns and information, prevention information, et cetera, across the country. And our affiliates make sure that that information is culturally responsive and appropriate to the region that they're in. It also helps in de-siloing the systems of care. We operate virtual support groups. Again, virtual support groups are big. It's great to meet in person. Childcare is a factor. We have the Recovering Mothers program through our Circle of Hope. And that's a group for women who have given birth to children with an FASD. It's a recovery and support group that's led by a birth mother. We also work with our state affiliates, and in some states we will offer a virtual educational support group for parents and caregivers that gives them education on raising a kid with FASD while at the same time supporting them and being there for peer support. And we look at externally a lot to improve our programs and services by hosting the International Research Conference. This year it's the Adolescent and Adult Focus. The year after that, in 2027, it'll be a full lifespan focus, but we host that so that we can bring the world into our doorstep and learn from the best practices of all of you, all the other countries in the world and all the other great work that's being done so we can make our programs better. So I'm going to talk from my mom heart for a minute. Raising 3 kids with FASD to young adults has been the greatest challenge and the deepest joy of my life. There were years I thought we wouldn't make it. We faced broken systems, uninformed professionals, and endless judgment. But we also found community, we discovered strengths, and witnessed resilience that still leaves me in awe. So one of my kids one day had to go to school and they had to give a speech. And they were struggling with, well, how am I going to sit still? How am I going to handle the lights of the cafeteria? How am I going to handle the noise in this place that I'm going to need to do this? I feel shaky, Mom. I just don't think I can do this. And I said, you may need support, but your heart, your spirit, and your mind are unshakable. Kids with FASD, adults with FASD tend to be their harshest critics. We need to give them that support. So our kids aren't broken. They may navigate the world a little differently. They may look at things a little differently. They may have impairments, but it's up to us to accommodate those impairments so that they can find their own path to success. So I've been asked to reflect on opportunities for the Mexican context. So Mexico, like the US and Canada, has vibrant communities, strong family networks, passionate professionals, and very large distances to bridge. And like many countries, it might face challenges with diagnostic capacity and access to diagnosis, service coordination, public awareness of FASD. What I'm really excited about and what's exciting to me in this moment and being here with you is that Mexico's in a position right now to build programs, support programs tailored to all the communities that you serve, honoring their uniqueness and their strengths. You don't have to replicate every little thing you see in every model, but you can adapt and integrate the best parts and create your own even better systems. I'm really excited to see that. So I have a couple ideas on how that could happen that I hope are helpful. I hope you celebrate strengths. You can launch public awareness campaigns that reduce stigma and highlight the abilities of people with FASD, not just their deficits. Because when that narrative shifts, so do the outcomes. A reflection on that. For years in the US, the majority of programs focus solely on prevention. And the messages around FASD were that it was 100% preventable. Well, what we learned is that it is not, in fact, 100% preventable. And that messaging can be actively harmful to women in recovery. And it's actively harmful to people with FASD. How would you like to learn that you and your uniqueness and your strengths and your areas of support are preventable? Ugh, that sounds awful. By balancing prevention with support and messages about people with FASD and messages about awareness of FASD and the harms of alcohol during drinking or during pregnancy, if you balance it, you can support both the mother during pregnancy and the family after pregnancy. But most importantly, you can support the person with FASD from the prenatal period to their adulthood. I hope you survey your landscape. Find the strengths in your communities and document the gaps. Keep that data. Document the strengths, document the gaps. Look for programs that are already working, maybe in other disability communities. What's the autism community doing in Mexico? Build on those strengths, build on those programs, build on things that are working using partnerships, strategic funding, community connections, and a whole lot of curiosity. Build a plan together, all of you together, all the different silos and areas of care on how Mexico will support people with FASD and promote healthy pregnancies. I hope you leverage your community health networks, train your local health workers, nurses, educators, justice professionals in basic FASD recognition and neurobehavioral strategies. I hope you build peer-led programs. I hope you connect to caregivers, to birth mothers, to people with FASD, and create programs that help them support their community. One of the greatest gifts in a community is the ability to give back. Let's allow people with FASD, let's allow birth mothers, let's allow families and caregivers of people with FASD to do that. I hope you integrate FASD into public health systems. I hope you include FASD in maternal health, education, pediatric screenings, mental health, and child welfare protocols. And if I can offer one final suggestion, in absolutely every situation, include families and, most importantly, people with FASD at every table. The red seat at the table, that can represent people with FASD being involved. We save a seat for them. We save a seat for their ideas, their opinions, their thoughts on how this disability should be supported. They are the original system navigators. They're the untrained therapists. The parents are the late night researchers and the fiercest protectors of potential. I want to leave you with this. Hope is not a wish, it's a strategy. And people with FASD and the mothers that gave birth to them deserve programs rooted in hope, not fear. They need systems that ask, how can we help you succeed? Not, why don't you fit? Why can't you do it? I hope you beware of the scarcity mindset and believe that there are enough resources, talent, energy, and enthusiasm to make a difference. And if we build with love, with science, and with lived experience as our compass, we can transform not just systems, but lives. Thank you for allowing me to be part of this journey with you. It is a privilege to walk beside so many families around the world. And to my own 3 kids, thank you for making me laugh, teaching me patience, and reminding me every day why this work matters. Gracias.
Muchas gracias, Jennifer, por tu participación. Muy conmovedora. El micrófono no sirve. Si me pueden ayudar encendiendo mi micrófono, por favor. Ahí quedó, ahí está. Muchas gracias por tu participación. Creo que todos estamos muy conmovidos, además de que toda la información que nos compartes es muy importante. Gracias. Tenemos unos minutitos para algunas preguntas. Si alguien tuviera interés en hacer alguna o algún comentario, es momento. Nada más tienen que levantar su mano y les pasaremos un micrófono. Gracias. Gracias.
Thank you so much for this presentation. I just want to, it's not really a question, but over the years I've heard over and over again, as a parent, your relationship with your child is the most important thing that you can develop and will be the most helpful to her as an adult. Would you speak to that, please?
We are the person of trust in our children's lives. We are the people who need to build them up. And when they behave in ways because their disability may not be accommodated, that can be hard. It can be hard to get that perspective. And so that's where the community building really comes in. Not feeling alone, feeling like you have someone else to help carry the water with you. And so I think working and focusing on being able to have that relationship with your child is huge. And it's not an easy path all the time. No kid makes it easy, whether they have a disability or not, right? That's parenting. But I heard somebody once refer to parenting kids with disability like Olympic parenting. It's parenting. It's just parenting on a different level. You just have to be more on your game. And so providing resources to parents, to caregivers, to moms can really help them be that person for the person with FASD. The more you educate and integrate the family into therapies and support, the better they're going to be able to carry that out at home and support and build that relationship. So I hope that answered your question.
Muchas gracias. ¿Alguien más tiene algún comentario? Por allá atrás. Gracias.
Thank you so much for your presentation and your work. I think it's amazing. And if may I ask you about the art that you presented us? So beautiful.
I wish I could say it was drawn by somebody special, but I chose it thinking about the feelings in my heart about my family. My feelings are soft with soft edges. My feelings are light and warm about my family. And so when I was looking for art within my presentation, I chose from Canva. But I really came from a place of what would represent me and my family and my view of how I would want to be supported. And it's a reflection of that. So thank you for asking.
Muchas gracias. Pues le damos un reconocimiento a Jennifer Wisdahl por su magnífica presentación.